injured on the job can lead to many problems, both medical and financial. And let's not forget all the paperwork that comes in order to file your case. That's where my next guest steps in to help. Here with more, please welcome back Dr. Mool Nigam from Texas Pain and Neurology, along with Claudette Nance, who was injured on the job. All right, good morning. Dr. Nigam, okay, so Texas Pain and Neurology is what we call a federal workers and Texas state comp clinic, because there are certain places people go when they're going through workers' comp and have been injured on the job.
Correct.
All right. So it has licensed medical staff, and it has everybody there that you think you might need, depending that can address whatever injury you may have had.
But we have a great team, and it starts with the staff that produces and carries on the paperwork.
Yeah. Because that's the toughest part. When you've been injured, it just, in fact, I was going to go ahead and go to Claudette and say that paperwork alone, some people just don't fill it out, period.
They don't fill it out, period, and then you lose out on the end, you know, because you really don't know.
Yeah.
If you haven't been injured, you don't know.
Yeah, because there are certain rules that you have to follow.
Right.
Exactly. But we have a great staff, and they are very friendly and help the patients through that maze of paperwork.
Yeah. All right. So, Claudette, you were working on your job. Everything's fine. And what happened?
I was working normal duty, doing my inventory, whatever I was doing.
Because this is one of the things no one expects to get hurt on the job.
No, and this box was there, and I don't know what happened. I was just walking by, and a customer said something. I turned around. When I went to walk, I went over from the box, and bam, to the concrete. Wow. Ruptured my disc. And
so you knew right away something was bad wrong?
No, not really. I didn't really. You know, I've been on my job doing what I do 20-something years. And my body went numb. I said, oh, I'll be okay. You know, no problem. I stood there a few minutes. I went to walk, and my body kind of locked. I said, well, maybe I need to go to the whatever. But anyway,
maybe I need to go lay down for a minute.
Yeah, maybe I need to go lay down for a minute. But seriously, you know, I thought I would get better. You know, they took me, and I went to the medical treatment and hot pack, and then 2 weeks later, I'm going to go back to work. I did go back to work. I was working, and all of a sudden, my body just locked. And over the years, well, the first year, it got worse and worse and worse. Then it got to the point I couldn't walk for like 3 months. Wow. Didn't know that my body was, my spine had wrapped, you know, my nerve had wrapped around my spine.
Yeah, and that goes back to Dr. Nigam. The problem here is if you don't get the correct treatment to begin with, an injury can just get worse over time. So that's the importance of having the great doctors and staff that you all have.
Yes.
Well, we have a very experienced chiropractor who helps me. And I have about more than half a century worth of training.
He has more than a half a century worth of training.
And with all the help I get from the staff, and then we try to bond with the patient.
Yeah.
Make the patient feel comfortable and tell their story.
Yeah, and when we say tell their story, it's so important because with your employer, you don't want them to think that you're so hurt that you can't keep your job. And I would imagine that was probably kind of weighing on you as well.
It was weighing on me because after all those years, you know, all of a sudden they didn't have nothing for me to do, you know?
Yeah.
And I went through depression. It goes through depression. I went through depression for a long time, but I had to learn to make myself happy.
Right.
You know, but you don't worry about your job at that time. They don't worry about you, but you have to be to this doctor. You have to get to this right doctor that can take you through the steps that you need, and that's what happened to me.
So you're affiliated with orthopedic surgeons and surgery centers and MRI facilities as well, but also psychiatrists who can help with that emotional component.
We're not exactly affiliated, but we make recommendations for proper diagnostic exercises. And the neurologist is trained in localization of the problem.
Yeah, finding exactly where it is.
If you don't find the exact site of the problem, then you can be led astray.
Yeah.
And
the person doesn't get well. In fact, in her case, she was getting worse.
Right. And This is often the case that we have conditions which get worse in spite of all the treatments. And that's where we try to treat the patient as family.
Yeah.
And find the right diagnosis as well as we can. And then treat them or recommend treatments to the patient. It's still the patient's choice what kind of treatments he wants. And unfortunately, we are forced to use drugs that are not entirely the most wonderful thing.
Yeah.
And we have to resort to narcotics. But for short term, we have to relieve the pain.
Help people manage the pain and then remove the problem.
More lasting forms of treatment.
Yeah. Which just kind of points out that not all comp clinics are the same. And so there are some that you go to that kind of rush you through the mill, if you will. But in your case, what you found here was somebody who stopped and said, let's find out what's wrong with you and let's get rid of the problem so you can get back to work. And also, let's deal with the emotional component. And I would imagine with a lot of businesses, what's important for them is you can get your employee back if they've been treated and put back to whole again. All right, the things you should do if you are hurt on the job, report it to supervisors, because if they don't know about it, you have no claim, right? Get it documented, important to do that, and also go to recommended doctors. And the importance, as we just talked about, of a correct diagnosis is that you don't injure something even more severely.
Yeah, that's what happened, I think, to me.
Yeah, all right. So that can go ahead and improve the outcome of your injury.
And return to work.
And return to work, all right. Because I can tell by your emotion, I mean, that your job meant something to you.
Oh,
that
yeah,
was,
it meant something. It changed
money.
my whole life,
Yeah.
you know. It just changed my whole life.
How are you today?
I'm good. Through prayer and faith, I'm good. But it's a lot of things I can't do. But I learned, you know, people tell me, you always look nice, you always this, you always that. They don't know some days when I leave here now, right now my legs are numb. Yeah. They feeling numb, you know. I can't drive to Dallas.
Yeah.
I can't work in my yard.
Correct diagnosis right away.
Yeah, you know, so, but I learned to live with the pain. They can't do anything for me but take everything out and replace it with screws. I don't see that happening to me.
Yeah.
So I learned to live with it, but I'm good.
Yeah.
I'm good. I have my good days and bad, but I'm all right.
Oh, all right. Well, Texas Pain and Neurology is offering you a free case evaluation. Just mention Great Day Houston when you call. To schedule an appointment, call 1-844-6-ARE-YOU-HURT. 1-844-6-ARE-YOU-HURT. That works out to be 1-844-678-4878. 1-844-678-4878. And for more information, log on to TexasPainandNeurology.com.